The issue of where we meet victims is such an important one to have conversation about internally and for us to wrestle with and figure out how can we be most flexible. So typically domestic violence and sexual assault programs have been designed with a self-help model, meaning we'll sit by our phone and you will call us if you're interested in help, and we're sitting here ready to go. And if you want emergency shelter, you will come to us. If you want a support group, you will come to us. We're dealing with a population, particularly of much older adults who did not grow up with a self-help model being the way that they operated. Most of their private, personal family business stayed that way. You didn't talk to strangers or others. You certainly didn't pick up the phone and start talking about your most private and personal family business with someone that you didn't know. And mobility and health issues may make it difficult to be able to come to a site to meet with an individual or with a group. So to the degree that programs can, of course, think about safety for both their staff and for the victims or survivors that they're working with, that needs to be paramount. But is there some flexibility in terms of policies about where people could be met? Can you meet at a healthcare provider's office or in a faith community, in Adult Protective Services office, at a restaurant for coffee? Are there ever situations where we can go into someone's home and be able to do that safely so that we're better meeting that victim where he or she is at?
The concept of mobile advocacy is one that many programs are looking at now. And there's some emerging evidence that suggests that mobile advocacy holds great promise to access community resources more easily when the locus of the service delivery is not a domestic violence program or a sexual assault program, which may be, for reasons of safety, not well known as a location in the community, but instead to have advocates go out into the community, be more accessible, be more visible, to be more open to providing services and supports in locations that the survivor themselves is more comfortable, already goes to regularly. There's also some evidence that there are some important safety benefits to that. Certainly for some survivors, coming to a domestic violence program holds its own risks, and the ability to find locations in communities where survivors can go to safely without raising the suspicions of an abusive partner. So it opens up a fuller range of safety strategies. And I expect that we'll see an increased use of mobile advocacy across a number of victim populations.